Hello friends, welcome to the channel Dewdear Academy. Today I am going to discuss a question from Kerala PSC DHS exam question paper, and the exam was conducted on 21/3/2023. So these type of questions and the explanation of the answers will be helping you to have a brief understanding of the topic. So the question is, the amount of filtrate formed in all the nephrons of both kidneys in 1 minute is termed as. Options: filtration fraction, glomerular filtration rate, glomerular capillary pressure, and colloidal osmotic pressure. The amount of filtrate formed in all nephrons of both kidneys in 1 minute. The correct answer is option B. It is given the correct answer option B, that is glomerular filtration rate. So what is glomerular filtration rate? GFR or glomerular filtration rate, it means the rate at which the kidneys filter the blood to form the filtrate. So it is usually measured in milliliters per minute, ml per minute, and the normal GFR is 90 to 120 ml per minute. 90 to 120 ml per minute is the normal GFR in healthy adults. That is the rate at which the kidneys are filtering the blood to form the filtrate, and it is expressed in 1 minute. It reflects the overall health of the kidney, and it helps to diagnose and monitor any kidney disease. So then you should be knowing what is filtration fraction. Filtration fraction means it is the ratio of GFR or glomerular filtration rate to the renal plasma flow. So it is the ratio of glomerular filtration rate and renal plasma flow, RPF. It represents the proportion of the plasma that is filtered through the glomeruli of the kidneys. How much is the proportion of the plasma is filtered through the glomeruli of the kidneys? So it gives the ratio or proportion. It gives the proportion of plasma that is filtered through the glomeruli of the kidneys. So it is the ratio of GFR to the renal plasma blood flow. And the normal filtration fraction is approximately 20%. The normal filtration fraction is approximately 20%. That means 20% of the plasma that enters the kidney through the renal arteries is filtered through the glomeruli. So how much is filtered through the glomeruli? Only the 20% of the plasma that enters the kidney through the renal arteries is filtered through the glomeruli, and the remaining 80% is in the it will be going into the peritubular capillaries. How much is going to the glomeruli? 20%. So that is the filtration fraction. It is a ratio of GFR to the renal plasma flow, or how much proportion of the plasma is filtered through the glomeruli of the kidneys, that is filtration fraction. Then next is glomerular capillary pressure and colloidal osmotic pressure. So first we will discuss what is the glomerular capillary pressure. What is glomerular capillary pressure? It is the hydrostatic pressure that is exerted by the blood. It is the hydrostatic pressure that is exerted by the blood inside the glomerular capillaries. So how much is the pressure exerted by blood inside the glomerular capillaries? That is known as the glomerular capillary pressure, and it is helping the fluids and solutes out of the blood into the Bowman's capsule, and how much it is helping in forming the filtrate, and ultimately how much urine is formed. All this is influenced by the glomerular capillary pressure. That is the pressure exerted by the blood into the glomerular capillaries, and that helps in pushing the fluids from the blood into the Bowman's capsule, and thus it forms the filtrate, and ultimately that filtrate is forming the urine. So how much pressure is needed to push the fluids from the blood out to form the filtrate? And normally the glomerular capillary pressure, the normal value is around 55 millimeters of mercury. It is approximately 55 millimeters of mercury. It is a pressure, so we will express the unit in millimeters of mercury. So the 55 millimeters of mercury is the glomerular capillary pressure. Then next we have the colloidal osmotic pressure, or we will call it as the oncotic pressure. Colloidal osmotic pressure or oncotic pressure. What is colloidal osmotic pressure or oncotic pressure? It is again the force exerted by the plasma proteins like the albumin. The force exerted by the plasma proteins like albumin in the blood plasma that pulls the water back into the capillaries from the surrounding tissues. So we can say it is just the opposite of the glomerular capillary pressure. These both are acting as in opposing manner. That is, colloidal osmotic pressure is opposing the glomerular capillary pressure, and thus it reduces the filtration. It pulls the water back into the blood, the plasma proteins. It pulls the water back to blood. Okay, pulls the water back into the blood. So that is, it is reducing the filtration. So anyway, these two pressures, these opposing pressures regulate the amount of filtration happening in the kidneys, and thus it is ensuring the proper kidney function. These two pressures are acting in an opposite way, and thus it helps in the proper kidney function. And what is the normal, the colloidal osmotic pressure? The normal value of the colloidal osmotic pressure is approximately, it is like 30 millimeters of mercury. 30 millimeters of mercury is the colloidal osmotic pressure. So the normal filtration fraction is 20%, and normal glomerular filtration rate GFR is 90 to 120 ml per minute, and the normal capillary pressure, glomerular capillary pressure is 55 millimeters of mercury, and the normal colloidal osmotic pressure is 30 millimeters of mercury. So these are the other important points associated with the options given in this question. So if we are discussing the question and if you are discussing the answers also, it will give you some additional knowledge, and that will be helping in understanding the topic, and it also helps to answer the questions more correctly. So I hope this video helped you a lot in understanding this topic. So thank you, and I will be coming up with again more videos, and that will be helping you again. Thank you all of you.